fire you and hire you back for less money. So this is basically things that are in effect now. Your guaranteed coverage, there's no medical exam, no pre-existing conditions. The government, I think the government contributes like 60 to 70% of the cost.
Hey girls, yours.
You pay your premiums with pre-tax dollars. And like I said earlier, your health insurance automatically goes into retirement with you. Retirees, you pay with after-tax dollars. And that was something I didn't cover when we were talking about a survivor annuity. Annuity for a spouse. If it's going to be important for your spouse to have health insurance through the FEHB plan, if you predecease them, you need to leave them a survivor annuity. It can be the full or the partial, but you need to leave them something in order for them to be eligible. Yes?
But if they're also federal employees, then that wouldn't be an issue, right? As long as they have FEHB.
That's correct. That's correct. I think on the next slide. Okay. Just like the life, yes ma'am.
I'm sorry, is there a requirement of period of time you have to have FEHB before you retire?
That's what I was just getting ready to talk about.
Okay.
Just like the life insurance, you do need to have the health insurance in effect for at least the 5 years prior to your retirement. You either have to have it in your own right or be on somebody else's FEHB plan. Like if both you and your spouse are federal employees and you're covered on his plan or her plan, that would count. You would have to produce the 2809s showing that when you submitted your retirement package. We would need to prove to OPM that yes, this person has coverage, and here it is.
Now, when you say 5 years, can we change plans within that 5 years?
Yes, as long as you've been in the program. You don't have to have 5 years with the same plan. You just have to be in the program. Or, you can, that 5 years also, or from when you were first eligible. I had a gentleman started his employment, for lack of better times, the 1st of March. You've got within 60 days when you first come on board to sign up for FEHB. And he waited a little while. We have a gentleman to get in. Before he signed up. So I think he waited one pay period. So his FEHB was effective like the middle of March. He was eligible to retire 5 years, so he retired like the end of February. So he had his 5 years, but he was like 2 weeks short of having 5 years of FEHB, but then he would fall under, he had it from when he was first eligible. So that's one way of, and most of you are not going to fall into that category, but if you happen to have come on board and will be retiring with 5 years, you may not have 5 years of full FEHB coverage, so there's a way. Also, this was a disability. No, this gentleman didn't go out. He went out on regular. He waited till an open season to sign up. You can also ask OPM for a waiver if there were some extenuating circumstances that prevented you. He had been covered under his wife's private plan, and then he decided to take advantage of the FEHB plan and have it for 5 years before he retired. So he signed up for it during one open season, and 2 or 3 years later he became very, very ill. He qualified for a retirement on his own merits. He didn't have to go through disability retirement, but he didn't have his FEHB for 5 years. And he had 20 plus years of service, so he was out of that within being first eligible. But he wrote to OPM, provided medical documentation showing that he was healthy when he signed up for it. Explained to them that, you know, when he signed up, he had planned on working longer, but it didn't work. And then he had the documentation about his illness, and OPM did waive the requirement so that he could take his health insurance into retirement with him. Health savings account. This is, again, while you're an employee, you can use it for qualified medical expenses. For this, your unused funds and interest do carry over. Keep the funds when you retire, and it's held in trust by the FEHB plan. So this is something that's through the plan that you have. This is what we just talked about. And again, about the FEHB into retirement. You do have to retire on an immediate annuity. If you do that postponed, where you're avoiding the age penalty reduction, your coverage would stop when you resigned your position, but would get reinstated when you applied to OPM for your retirement. Like I was saying, OPM has the authority to waive the 5-year rule. Coverage under TRICARE counts as qualifying for the 5 years. However, if you have TRICARE and you want an FEHB plan in retirement, you have to be enrolled in an FEHB plan when you retire. Okay. Like I was saying, continuation for your family members. You must provide for a survivor annuity in order for your spouse to keep the FEHB plan if you predecease them, and you must be in a family plan, or individuals like we were talking about. But if your spouse is not a federal employee, and if you retire with a self-only plan, then your spouse will not be eligible to pick up the FEHB plan. So you must have been in a family plan to have him or her covered, as well as leaving them a survivor annuity. Okay. Changing, as you all know now, there's annual open season to allow you to make changes in your plan, or if you experience a qualifying life event, which there are many. I think the alphabet goes to like R or S. There's like 20 different qualifying life events that could happen. When you're a retiree, you will still be allowed to participate in open season, make changes. The qualifying life events are not quite as numerous as a retiree as they are when you're an active employee. If you do make a change based on a qualifying life event, you have 60 days. It says 31 days before or 60 days after. You can send it while you're an active employee with us. You can send in your paperwork up to 30 days before the event, but it's not really going to take effect until the event happens. Just in case, especially like with marriages. Some might happen and they might not. They might not happen. And we can't finalize the processing until we have the proof, i.e. your marriage certificate, that it did happen. The birth of a baby. Okay, you know the baby's coming. Yes, you can send in the paperwork. But on the birth of a baby, it's the day the baby's born that's the date of the event. So we can't really process them until the event happens. Okay. Dental and vision. 10 carriers that are offering dental plans, 4 for vision plans. I'm not sure what's happening for the next open season. They haven't released. That information should be coming out shortly. You can enroll in a dental or vision plan during open season. No pre-existing conditions, no waiting periods. The government doesn't contribute to any of the premium. Self plus one, self and family plans. So taking it into retirement. You can take it into retirement with you, but it doesn't automatically happen. It kind of sort of does. OPM does not allow for those premiums when it's working on your annuity, and even when it finalizes. What you need to do is, there's two ways to handle this if you have a dental and or vision plan and you want to take it into retirement. First off, the 5-year rule doesn't apply. It doesn't matter how long you've had it, you can take it into retirement. You can either contact your carriers ahead of time and tell them that you're going to be retiring on such and such a date and make arrangements with them to pay the premiums directly. Or, once you retire and your retirement action goes through the system, they get notified electronically that you've retired, and they're going to send you a letter saying that you need to pay the premiums directly. Yes, sir?
So, I understand you don't have to have 5 years like you do in the healthcare, but you have to be enrolled prior to retirement, even if it's 1 day.
Yes.
Okay.
But you can also sign up for this after you retire too.
Even if you have not before.
Even if you have not before been in it. Yeah.
It's the same premium.
Yes. Government doesn't contribute anything to these. Because you're a retiree, you're still eligible to enroll. Yeah, no continuous coverage. If you are enrolled, you are responsible for the, just because you retired doesn't allow you to cancel it. You are responsible for the premiums through the end of the coverage year. Yeah, you can only cancel during open season. And you can enroll or re-enroll doing a qualifying life event, and their qualifying life events aren't even as generous. Okay. Now, unlike FEHB, where if you were in a self-only plan and you predeceased your spouse would not be eligible for FEHB. FedVIP, you don't have to be, your survivor, your spouse does not have to be enrolled. You don't have to be in a family plan or a self+1. If something happens to you, your spouse could still enroll in this as well. And if you did have the family plan or self+1, your survivors would automatically be covered. Long-term care. This takes care of you if you go into a nursing home. Pretty much, you decide. They really don't have open seasons anymore. Yeah, but you have to go through a physical type thing. I think full underwriting to, if you aren't already enrolled and want to enroll in this, you would need to go through what they call underwriting process, where I think you have to get a full physical done to show that you're in good health. And the premiums are based on your age, and there's, I think on the next slide, maybe not, there's like waiting periods and how much increase. Their website provides a lot of good information. There's a lot of other people that you can cover on this that you can't cover on your FEHB or FedVIP. You can carry your parents, your in-laws, your adult children, federal and military retirees, so you can take this into retirement with you. Here we go. So on your age, time of purchase, you pay the entire premium. There's a calculator at longtermfeds.com, because there's some choices that you make that determine the premium. Yeah. Inflation is one of the factors that contributes to the premium, the benefit period, and your daily benefit amount. You pick how much you want to be covered for each day. And there is a 90-day calendar waiting period. You only have to meet it once in your lifetime, but they would not pay benefits for the first 90 days. Flexible spending accounts. This is something that is nice to have while you're an employee, but this is one benefit that is not eligible to go into retirement with you. So, as if any of you have a FSA account, I just recently, like 3 or 4 years ago, learned the benefits of this, and I'm loving it. So, you know, if you don't have it, the way it works is when you go to the doctor and pay your copay, you sign up for how much money you think you're going to spend throughout the year, and you start paying in it. It takes a payment out of your paycheck for 26 pay periods. Then when you go to the doctor and pay your copay, FSA sends you a check for whatever you paid. When you pick up a prescription, it sends you a check for whatever you paid. I just recently submitted for my new glasses. That wasn't an automatic. It's tied in with your FEHB, and I have optional dental too, and you fill in all that information. So they automatically know when a claim has been filed against your FEHB plan or your FedVet plan and how much you paid. So it's paperless. They automatically issue the payments out to you. Unfortunately, if you don't spend all the money you think you were going to sign up for, and I had forgotten that when my husband retired, I didn't put him on a family plan. So when he goes to the doctor or his prescriptions are through his own self-only plan, I've got the FSA, so I can't get his. I think I'm going to be leaving money in the account this year. The extra money that you don't spend doesn't roll over. Now, right now, you do have until March 15th or 31st to still use it. But they are changing that for 2015, that only dependent care FSAs will have that grace period. So for 2015, I think you're going to have to use the money by the end of the year. No?
No, it's gonna roll over.
500.
It's, oh!
500 of it, yeah, will roll over from now on.
Okay, I haven't read up on all the information on it yet. I just know there were changes.
Yeah, dependent care will stay the same. The limited and the health care will change. Yeah, the dependent care will stay the same. The health care and the limited expense accounts are going to change. No more grace periods. You can carry over 500. And we're coming out with an HRM notification that will be out very shortly on that.
That's good to know.
And where do you submit your claim online? Do you have that? Sorry. Thank you.
Where do you submit your claims?
Yes.
It's coming up? Okay. It's coming up. So, while you can't use this to pay your premiums, it pays your eligible medical expenses. Okay. Dependent care covers children up to 13. Adults who qualify under a dependent. I had my mother living with me for a while. Unfortunately, I didn't know at the time. I had her in an adult daycare program, and I didn't realize that at the time I could have applied for reimbursement. I could have put in for the dependent care FSA and gotten some of that back.
Is it true that under the FSA, that if you're under, like if you have a husband or a spouse that's retired from the military, that you're not allowed to enroll in the FSA?
Question is, if you have a spouse that's
Retired from the military?
military
and
or
you-
federal, or
military.
just military retiree,
And if I wanted to use FSA, I could not because I'm eligible under his plan, even though we don't use it?
I'll defer to Jeff on that.
If you're covered under a TRICARE plan, no, you're not eligible. So if you're covered under his TRICARE and not FEHB, you're not eligible.
Well, I have a FEHB,
So
I don't
you're
use
eligible.
TRICARE.
So you're eligible.
Oh, okay.
Can you repeat?
The question is, if someone is a military retiree, can the spouse, the federal employee spouse, is that person eligible or not eligible to participate with FSA, flexible spending accounts? If that person, if the federal employee spouse is covered under the TRICARE plan, no, that federal employee cannot participate with FSA. But if you have your own FEHB plan, then yes, you can do FSA in your own right through your FEHB plan. Okay, limited expense healthcare FSAs. These are only if you're in a high deductible health plan. There are certain expenses that it's limited to. Cosmetic expenses are not eligible, and you can only do a maximum of $2,500 per covered employee. Now the FSAs, all of them, the health and the dependent cares, you need to re-enroll for those each year. They don't automatically roll over from year to year. And you can make changes as a result of a QLE. You enroll online at fsafeds.com. And that's where you would submit your claims. If you had, like I had to submit my own claim for my glasses, it wasn't automatically submitted to them. For healthcare expenses, like I said, most of the time, when you sign up for this, it asks you about your other plans. It asks you, you know, your FEHB plan, who you have it with. I think you enter your social security number. You might even, it wouldn't be an ID number. But somehow they're all linked. So that when I get prescriptions and I go to the doctor, there is no paper. They automatically know that they need to send me money. I don't have dependents. I just started being a grandparent, so I'm not sure how the dependent care reimbursement works. If anybody can, okay. And it is electronic funds. It's you give them your banking information as well. It's direct deposit right into your bank account. And like I said before, the FSAs is one benefit you cannot, any way, shape, or form, take into retirement with you. They've not allowed for that. Okay, useful resources. We have a website called VIBE, Virtual Interactive Benefits. It's a frequently asked questions format where you get in there and there's all kinds of categories you could look at to get information. These are a lot of the categories that are there. Yeah. The searchable database on a frequently asked questions format. Like I said, you can search by topic, category, keywords. You have access to it 24/7, either through CBP Net when you're at work or CBP.com. I think the CBP.gov. And these are the different ways to get to it. An FHR Navigator. Now Jeff left us. But we're still not quite totally done. But have any of you been on FHR Navigator? Okay. This is a system where if you've not requested an estimate from our office, which we restrict you to 1 per year, and you've got to be within 2 years of retirement. And what happens if you fall into those categories, we will look into we will pull your EOPF, and we will enter your service history in the system. So that when you get an estimate from us, your service is all in there, and it's pretty up to date. If you've not requested an estimate from us, and your service history has not been entered, the system will allow you to get a retirement estimate based on your service computation date. So if you've not had any weird circumstances of like refunds not being paid or military service that you've not paid a deposit on, most cases your service computation date, SCD, is correct, and that's how it's going to do your retirement estimate. There's a lot of tools on that website as well for planning for retirement. If you have no idea how much money you might need into retirement, it will help you figure that out. It will allow you to do optional disability, early out retirement estimate. And again, this system is also available 24/7. You can access it from home. Your EOPF can only be accessed while you're at work. Are you taking no, or it shouldn't be that way?
You can access it from home.
Yeah.
You can?
Yes.
Because I've tried doing it and it...
Yes.
Okay. So there's the link to get to FHR Navigator. You do have to have a user ID and password. There's instructions on there, and if you have trouble, like I said, Jeff is our administrator. These are our contacts as well as OPM. Any more questions?
Kid back right at the right time.
Yeah, he did.
Medicare, Medicaid.
Medicare, Medicaid, good question. I would suggest to you that as soon as you're eligible for Part A of Medicare, which is the free one, to sign up for it. Part B, as long as you're still working, even if you're beyond the age when they tell you, you're 65, I think you need to sign up for it. If you're still working, you still have that window. But if you've retired and you don't sign up for it right away, then you've got 6 months to sign up for it, and after that, they start charging you more if you sign up down the road. Some people ask about keeping their FEHB plan after they've signed up for Medicare. And you can do that. Because there's things to consider. Medicare will only pay 80%. Now, if you do keep your FEHB plan after you've signed up for Medicare, your FEHB plan becomes secondary, but the premiums don't change. But what a lot of the plans do is they then start paying your co-pays and your out-of-pocket, so that you literally do not have anything out of pocket, because they are no longer the primary. They're not paying out as much as they were before. So, you know, the 20% that Medicare doesn't cover, your FEHB plan would cover. You would have your prescription coverage through your FEHB plan. Part D, I checked into that for my mom, and it was cheaper for us. She only at the time was on like 3 or 4 generic medicines, and it was cheaper for us to just pay out of pocket for her medicines than to sign up for Part D.
So now I'm going to hit you with long-term care. I go to a nursing home. I get Medicare for the first something like 100 days, and then you end up paying